In today's session at Medical Sciences, we're going to dive into factors that affect the rate of antigen-antibody reactions. And there are different types of antigen-antibody reactions in blood transfusion. But before we start on the factors, we need to know some of the antigen-antibody reactions applied in blood transfusion. And as we start, we urge you to subscribe if it is your first time, share to many others so that we can continue to serve you more. So we're going to see the antigen-antibody reaction. Some of them we have what we call hemolysis, or we have what we call we have agglutination, we have sensitization, neutralization, complement fixation, and so many others. Whereby hemolysis or agglutination is brought about by antigen-antibody reaction, whereby they bring cross-linkage. But before we look at how it comes about, in the normal situation, if these are red cells, we have one RBC, we have another red cell. These red cells, they contain a carboxyl group. On the surface, they have a carboxyl group. And these carboxyl groups on the surface of stearic acid, it creates a negative charge across the red cell. So RBCs, they are negatively charged across them, or around. They are surrounded by a negative charge created by these carboxyl groups on the stearic acid. And because all the red cells, they are negatively charged, they tend to repel. They repel from each other, so they cannot come together because of this negative charge along the red cells. And how do we overcome this? This repulsive force, or the negative charge, creates a potential which we regard as zeta potential. So this is the zeta potential. So the zeta potential, which prevents red cells from coming up together or clumping together, is what we are calling the zeta potential, which is the repulsive force or the negative charge around the red cell. So we are going to see some factors that they are going to aim at reducing this repulsive electrostatic force. That when we reduce these negative charges around the red cells, because this one we say this is an RBC, this is an RBC. So if we reduce this zeta potential, we are able to enhance or to increase these cells to come together. So if I reduce the zeta potential, if I decrease it, these RBCs are able to come closer together. They come closer together. And when they come close together, then they increase the chance. That is due to a reduction in the negative charge. So if this is an antigen on the surface and there is an antibody combining, they easily cause cross-linkage. They easily cross-link together, hence producing visible clumping, or what we call agglutination, during blood grouping. So what are those factors? We're going to see factor number one. The factors include itself the zeta potential, the degree of the zeta potential or the repulsive force. We are going to see another factor as the antigen-antibody ratio. We are going to see factors like temperature, We are going to see factors like pH of the media. pH, how does pH affect the rate of antigen-antibody reaction? We are going to see other factors like antibody type, the type of antibody. Then we shall see also number of epitopes, or what we call the binding sites, because the binding sites of antigen are known as epitopes. We can even the number of epitopes or antibody binding sites. Then other factors we are going to explain on another factor, like we are going to see the centrifugation time, we are going to see the incubation time. But before we go to that, we have even the suspension media. Suspension media. Then we shall have centrifugation speed. Centrifugation speed. We shall have incubation time. As another factor. Then we shall also have another factor, like this is incubation time, then treatment with proteolytic enzymes. Proteolytic enzymes. So these are some of the factors we are going to look at. Then we cannot also forget the ionic strength of the media. Ionic strength of the media. So these are the factors we are going to discuss with you in this session, so that in case you ask an exam, you are able to know these factors. So how does the repulsive force, zeta potential, we are calling it the repulsive electrostatic force. What is this force? This is the negative charge around the cell, red cells, that prevent the cells from coming closer together into close proximity. So when there is increased zeta potential, when the zeta potential is high, meaning the cells are repelling each other, they cannot come closer together. So increase in the zeta potential decreases the rate of antigen-antibody reaction. So the rate of antigen-antibody reaction is zero. Why? Because the red cells are far away from each other. They cannot easily come close together to close link, form visible clamping. But when the zeta potential is decreased, then the antigen-antibody reaction is faster. So this one is inversely proportional to the antigen-antibody reaction. Then the second factor is antigen-antibody ratio. The ratio should be optimal or should be equivalent. Should be the ratio of the antigen to the antibody should be equivalent. For example, if you have 4 antigens, they should also be equivalent to the binding, the epitopes on the paratopes on the antibody. So if you have excess, what we call the zone of excess is what we call prozone. If there is what we call prozone phenomenon, so we are going to see that when the antigen and antibody ratio, or they are equivalent, the rate of antigen-antibody reaction is high. It occurs because there is ability of lattice formation. But when there is antigen excess or antibody excess, what we call the prozone and the postzone phenomenon, here there is no lattice formation and antigen-antibody reaction does not occur very well. Hope you're understanding this. So we are saying the ratio of the antigen to the antibody should be optimum or should be equivalent, so that we can form lattice, so that we can see invisible agglutination. But when there is antibody excess or antigen excess, which we are calling prozone phenomenon and postzone phenomenon, there is no agglutination due to failure of lattice formation. So we should always, in case there is antibody excess, we should always dilute the sample by doing double dilution, the serial dilutions. Then factor number 3 is temperature. How does temperature affect the rate of antigen-antibody reaction that brings about agglutination or hemolysis during blood grouping? We are going to see that some antibodies are known as warm and others are cold. And antibodies which are known as be warm, a good example is IgG type. Then the cold, a good example is IgM type. And we're going to see that these different immunoglobulins or antibodies, they react best at their optimum temperature. So we're going to see that these warm antibodies react very well at 37 degrees centigrade, whereas cold antibodies react well between 4 to 22 degrees centigrade. So this is where they act best. So for you to yield a good agglutination due to antigen-antibody reaction, if you're dealing with IgG, it is better to perform the test at 37 degrees. And when you are dealing with cold antibodies like IgM, it is better to do it at room temperature, that is between 4 to 22, for you to yield good results. Below or above, the reaction is tampered with, or it is hampered. What about pH? How does pH affect the rate of enzyme, the rate of antibody antigen reaction? pH, we are going to see that these antibodies we are dealing with react well at a pH between 6.5 to 7.5 with average of 7.0. So they act best at the neutral pH. They act better at the neutral pH. So if you are performing antigen-antibody reactions in either acidic or basic media, the rate of antigen-antibody reaction is decreased. Why? Because these guys, they are going to affect the repulsive forces and the hydrophobic bonds, the hydrophobic interactions, the electrostatic forces. They are tampered when you perform in acidic or basic media. So the average should be 7, or it should be performed at neutral pH for you to yield good results. Then what about antibody type? Antibody type, there are types of antibodies. Some are regarded as complete antibodies. We have what we call complete antibodies. Others are incomplete. The complete antibodies, an example is IgM. And this IgM is large in size. It is, if I have the G portion, for it, it is pentameric. It has 10 paratopes or 10 binding sites. Compared to the incomplete, for example, the peculiar one is IgG. For it, it is monomeric. It is monomeric. So, if you're dealing with complete antibodies like IgM, due to different or to many bit big in size with 10 binding sites, it can easily cause cross linkage. For example, if you have these red cells together and you have the IgM, it can easily cause cross linkage leading to visible agglutination, compared to the IgG, which is monomeric. For it, it does not easily cause cross linkage. So we are saying that antibody-antigen reaction is faster when dealing with complete antibodies like IgM, because they have multiple binding sites, compared to the incomplete antibodies like IgG, which are small in size and they cannot easily form. They only sensitize without causing visible clamping or agglutination. So this is how we can explain the type of the antibody or the immunoglobulin. Then we have another factor, which is number of epitopes, that is the antibody binding sites on the red cells. So if I have a red cell And this red cell, they have different antigens. They have different antigens. And we're going to see that antigens which are derived from ABO, that is antigens which are of this, that is antigen A and B. These ones have multiple binding sites compared to the antigens, that is antigen D from the rhesus grouping. So we are seeing that these antigens, they have larger number of, that is 100 times more than the rhesus type. And this one enhances agglutination, or what you are calling antibody-antigen reactions. So the more the number of epitopes, or the more the number of binding sites presented, the higher the rate of antigen-antibody reaction. Then we have what we call suspension media. Suspension media, we use colloidal type, e.g. we can use bovine serum albumin, we can use PEG, we can use protamine. All these are protein media. And these protein media, they are colloidal. And being colloidal, they are able to reduce the negative charge. So they act by reducing the zeta potential. These protein suspensions decrease the zeta potential by decreasing the ionic charge around the red cells. And when we decrease the zeta potential, we increase the rate of reaction. So tests which are performed in media like bovine serum albumin, presence of polyethylene glycol and protamine, they easily agglutinate because these guys are able to reduce the zeta potential, or the negative charge, or the repulsive force around the cells. Then centrifugation speed. This factor number 8, 9, and 10, these ones are commonly used to enhance agglutination. And when the centrifugation speed is high, also the rate of reaction is also high. So these are directly proportional. And if it is low, also the rate is low. That is how we can describe this factor, centrifugation speed. So if you want to achieve agglutination or hemolysis faster, you increase the centrifugation speed. If you want to delay for some time, you reduce the centrifugation speed. Then incubation time. Some antibody-antigen reactions require incubation time for them to react. And we are going to see that the higher the incubation time, or the longer the incubation time, the higher the rate of reaction. And when the incubation time is short or is small, the reaction will take long. The antibody-antigen reaction will take long. So, but this one depends on the optimum time recommended by the manufacturer. So if they are saying we should incubate for 5 minutes, and for you incubate for 2 minutes, you get false negative results. And if they say the optimum is 5 minutes, and for you incubate for 10, you are easily to get false positive. So incubation time is very key in antigen-antibody reaction. Then treatment with the proteolytic enzymes. If we treat first these cells with proteolytic enzymes like trypsin, like papain, enzymes like papain, chymotrypsin, these enzymes, they are able to come and digest the stearic acid. This sialic acid is the one that is carrying the carboxyl group with the negative charge. So when you treat it with these enzymes come and digest all the proteins around, and after digesting them, they are able to decrease the zeta potential. This one leads to reduction in the negative charge, which we call the zeta potential. And when the zeta potential is reduced, the antibody-antigen reaction is increased. That is the role of pyruvate enzymes, which digest away this sialic acid. And when they digest them away, one, they reduce the negative charge, and again, they expose the antigens for easy binding, hence increasing antigen-antibody reaction. Lastly, but not the least, we can also talk about the ionic strength of the media. And this ionic strength, one of the media that we are using to reduce the ionic strength is LIS, low ionic strength saline. So when you use low ionic strength saline, it is able to reduce the ionic strength or the cloud surrounding the red cells. And when the cloud is reduced, it is going to decrease the zeta potential, hence increasing agglutination or antigen-antibody reaction. So ionic strength is always reduced by using low ionic strength saline, which is able to reduce the zeta potential or the ionic cloud around the cells, hence making them to come to close for irreversible clamping by cross bridge formation. So these are the factors we can discuss with you. Zeta potential or the repulsive force, the antigen-antibody reaction, the temperature, pH, the optimum, which is 7. Then you have seen antibody type that IgM react faster compared to IgG, which are incomplete. Then number of epitopes, we have seen them. Suspension media, like these albumins, which reduce the negative charge. The centrifugation speed, incubation time, then treatment with the proteolytic enzymes and ionic strength. Thank you so much for learning with us at Medical Sciences by Naftali Muhumza. We urge you to continue sharing to many others. Keep subscribe if you haven't, and continue to tell the good news to many. Thank you for continuing to learn with us. May God bless you.